like to call the meeting to order. Good morning, ladies and gentlemen, and welcome to meeting 7 of the Economic and Community Development Committee. I want to welcome everyone back from, I guess, the somewhat summer break. It was slow and fast, all in one stream. And so it's good to see everyone back. I hope everyone had a chance to get some rest and R&R. And if you didn't, Christmas is coming, right? So, and so, welcome to members of the committee members and also visiting members of council who are here. I see a number. See Deputy Mayor Holliday is here, and I see Councillor Ainsley, who's no stranger to this committee, as a visitor. So thank you, Councillor Ainsley, for being here, and Deputy Mayor Holliday, thank you very much. And as well to certainly the members of the public who are here as well, and to the media. You can also follow the agenda and debate on your computer, your tablets, or your smartphone at www.toronto.ca/council. The Economic and Community Development Committee acknowledges that the land we are meeting on is the traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewas, and the Hautestonis, as well as the Wendat people, and is now home to many diverse First Nation, Inuit, Métis people. We also acknowledge that Toronto is covered by Treaty 13 of the Mississauga of the Credit. I welcome as well visiting Councillor Fletcher, and good morning, Councillor. So members, we have not necessarily a robust agenda, but sufficiently there are a number of items that we have to address. We also have 3 new business items which I will look to add to the agenda in a moment. And just before I start with the review of the agenda, and members can do their holds, and before we do the declaration, I'd like to welcome a new addition to the team of EDC, which is an amazing team of men and women who are working hard to make this city a great place to work, great place for investment, great place for traction, as well as great place for community engagement, community development, community safety in general, and so on. That new member, in addition to the team, is Mr. Sunil Johal, who is the Director of Business Growth Services, position formerly held by George Spezza. And as I said, he's not the new George, he's the new Sunil. And so I want to welcome you, sir. Welcome to the team. I would like to ask maybe the General Manager for Economic Development just maybe to say a couple of words or so, because you were responsible for this great hire. Thank you. Mr. Williams?
Thank you, Chair. Sunil joined us about a month ago now. Came from the Mowat Center and the province. Immediately before joining us, he was chair of a federal government task force looking at future work in federally regulated industries. Has a lot of experience with private sector interface with government, a lot of policy. Hopefully will help us become more purposeful in the way we design and deliver our programs, and so we welcome Sunil and his fresh perspective to the way we can do our job.
Okay, thank you very much, and congratulations. Welcome to the team. So members, are there any declaration of interest on the Municipal Conflict of Interest Act? Seeing none, thank you. I'd like to request a confirmation of the minutes of the June 26th meeting. Vice Chair Grimes, all those in favor, opposed, that's carried. Thank you. We do have a list of speakers on a few items, and I will get to those in a moment. EC 7.10, we have a number of speakers, and then we also have some additional new business that I'll add, and I know that we will have some speakers on the one that I'm bringing forward, which is the breaking the cycle of violence with empathy. When I add that, I will read the speakers'
Mr. Chair?
Yes.
You said we have a number of speakers on item number 1?
No, I didn't say number one. CEC 7.
Oh, okay.
No,
Sorry about that.
It's okay.
I thought I had.
that was a test.
I thought I was missing a page.
No worries. I think that was a test for me, right, Councillor Carroll? I'm awake, yes. Okay. We are now ready, members, to go through the agenda. EC 7.1, Toronto Fire Service Transformation Plan Update.
I'd like to hold that. I have one
Okay,
quick question.
Councillor Carroll, okay. Your name? Thank you. All right. EC 7.2, non-competitive agreement with Zoll Medical Canada, Inc. for the purchase of defibrillators for Toronto Fire Service operational apparatus. So move, okay. Councillor Cressy is moving this item. All those in favor? Opposed? That's carried. Thank you. EC 7.3, donation from a resident for Regent Park programming. What say, members? Okay, thank you. Yeah, Councillor Carroll's moving the item, and also Councillor Cressy has expressed his thanks to former staff member and leader of Social Development and Finance, Mr. Chris Berlinger, who has given a contribution, is it $250,000? And I understand, I'd asked the question because I didn't know whether or not we've had any other staff members, current or former, who've made a contribution of this kind, and the answer was, this is groundbreaking, this is precedent setting. So to all the staff members that are here, we're starting big at 250, and so we just want to let you know. Mike? That's right. So all those in favor, okay, that's carried. Thank you, and thank you again to Mr. Berlinger. EC 7.4, engagement of nonprofit organization to provide mentoring programs for children's age 7 to 11.
Can I hold this one?
Absolutely, Councillor Carroll. I think there's also a motion that we have as well, that it's okay. I'll put that in your name, Councillor Carroll. Okay. EC 7.5, authorization to enter into a funding agreement for Enterprise Toronto. Okay, Vice Chair Grimes is moving the items. All those in favor? Opposed? That's carried. Thank you. EC 7.6, formation of a business improvement area in Scarborough East of McCowan
Yeah,
Road.
can we hold that on behalf of Councillor Ainsley?
Okay, Councillor Eanes, we'll hold that. Okay, Councillor Deputy Vice Chair Grimes. Okay, EC 7.7, Los Angeles Mission 2019. This item's here for receipt. Okay, Councillor Carroll's moving receipt. All those in favor? Opposed? That's carried. Thank you. All right, EC 7.8, animating winter in Toronto. First steps update.
If there are no deputants, I have a very quick amendment, and with that, if it's the will of committee and the chair, I'd be happy to move it quickly and move on. It's for asking the GM of Economic Development to review opportunities to partner with BIAs for winter animation and to report back.
Yeah, but that's great. It was always intended to do that, but it's instructive, so that's very helpful. Yeah, that's absolutely. So all those in favor of the motion that Councillor Cressy is putting forward? Okay, opposed? Okay, that carries. Thank you. So item as, that's right. Okay, we're amending. This is being amended. So item as amended. All those in favor? Opposed? That's carried. Thank you. Okay, thank you, Councillor Cressy. It's a good motion. EC 7.9, Toronto Economic Bulletin. What say you, members? Okay. Councillor Carroll is moving receipt. All those in favor? Opposed? That's carried. Thank you. Oh, sorry, move adopted. Okay, thank you. Yep. All right, so we are now moving to EC 7.10, implementation of coroner's recommendation from the Faulkner and Chapman inquests. We do have some speakers on that particular item, where I'm going to be holding that in the chair's name. Okay, moving right along, EC 7.11, Film, Television, Digital Media Advisory Board, Workforce Requirement in the Film Industry. Okay, the chair of the film board, who is a visitor today and has indicated that she is in support and wishes that to be moved. Councillor Carroll's moving that. All those in favor? Opposed? That's carried. Thank you. Okay, so members, we have 3 additional new items of new business. The first is from myself, and I read it out earlier on, breaking the cycle of violence with empathy. I'd like to add that item for new business. Okay, and can we just do the votes all together on all 3? One by one. Okay. All those in favor? Opposed? That's carried. Thank you. We then have the second item. This is from Deputy Mayor Holliday. It's an item for new business. You have it in front of you. All those in favor? Opposed? That's carried. Thank you. We're adding that to the agenda. And then the final item is from Councillor Fletcher. You have that item in front of you. Invite you to read that. So all those in favor? Opposed? That's carried. Thank you. So these items have been added to the agenda. Members, I would like to...
Mr. Chair.
Yes.
Chair, just a quick point of order. The report on the trade mission to LA.
Yes.
We adopted that automatically. Does that appear on the council agenda?
It does go to council, yeah.
I just wanted to point out while we're in committee, I hope that when you introduce the economic development agenda to council, that you will point out that report's in there. So often we go on these missions and then what we hear is we go on these trips and we never hear anything. And in fact, we deliver reports to this committee on a regular basis of what happens on those missions. So I just wanted to note while we're in committee that we all heartily support you highlighting that when we get to council.
Thank you very much, Councilor Carroll. You know, for years we've been putting reports out and so on, nobody reads them, so it
Yeah,
comes
but
rather
that
redundant.
amount of
But,
work
yeah,
was done
absolutely.
and the partnership made it a very affordable trip with
Absolutely.
the net benefit needs
absolutely
to be
right.
highlighted on television.
Okay, thank you very much, Councilor Carroll, and I will note that. Members, I beg your indulgence. I would like to do the following things in terms of just to altering the agenda a bit. I propose that we deal with the item that I have added as new business, breaking the cycle of violence with empathy, as the first item of business. We have Brandy Tannenbaum and Dr. Avery Nathans is here. He's the chief of surgery and director, I believe it's trauma at Sunnybrook Hospital. And then we have the next item that I would propose would be the second item on the agenda would be EC 7.1, the implementation of the coroner's recommendation. Sorry, 7.10. Right. 10. Yes. And so I propose that we do those items. Okay, members, in agreement? Okay, great. Thank you very much. Okay, so we will now start the meeting and Councillor Holliday's motion. Does anyone have any issues or concerns with this? Okay, you would have him stay at the meeting. We'll have him stay. Not, okay. Oh, fair enough then. Okay. All right. So I would then like to invite Dr. Nathans and Ms. Tannenbaum to come forward and to speak to us regarding the breaking the cycle of violence and empathy initiative that you are looking at introducing, I guess, to the City of Toronto. You will both have, I will give you both 5 minutes each to speak to create an opportunity so that we can get the full understanding and undertaking of what you're about to embark on. If you need the full amount of time, that's fine. If you don't, that's fine as well. So this is your first time here. While you present, members, after you've concluded your presentation, members may have questions of you, and you are then required to provide an answer. This, unfortunately, isn't a situation where you then ask them questions and so on. So the clock is on your left. Maybe just ask you to just keep an eye on the clock, and welcome to the committee.
Well, good morning, Councillor Thompson and members of the committee. I want to thank you for allowing us to present a potential opportunity for collaboration between the City of Toronto and the trauma program at Sunnybrook Health Sciences Centre. I've been a trauma surgeon for the past 20 years and lead the Torrey Trauma Centre at Sunnybrook. And I don't think that any of you would be surprised to hear me say that there has been a profound change in the types of injuries my team is caring for. Now it is rare for us to go even a single night without attending to a patient who has been shot or stabbed. Many of these patients do well, but a small number have tragic outcomes. What's most frustrating to us is that we know that many of these injuries are entirely preventable. While legislation to get the guns off the streets is one approach, there are others. And I want to provide some anecdotes to illustrate where these other opportunities might lie. In 2007, we cared for a young man who was shot and had minor injuries. So minor, he didn't require admission to hospital and was sent home from the emergency department. A few years later, he was shot again, and his life changed in an instant. He suffered a severe spinal cord injury and now requires a wheelchair for life. Another more recent tragic example. A teenager was shot in 2014. He required surgery for a few broken bones and was sent home after a very short hospital stay. 2 years later, he returns to our trauma center having been shot again, but this time it's too late. He's pronounced dead on arrival by our trauma team. These stories really are becoming just far too common. Clearly, the approach of patching them up and sending them home is not enough. Imagine if there was a way to interrupt the pattern of violence and change a young person's trajectory. Imagine if that solution existed here in Toronto. And this is what we want to share with you from our Centre for Injury Prevention. Brandy Tannenbaum, our program coordinator for the Centre, will take it from here.
Thank you, Dr. Nathans. The Centre for Injury Prevention has a tradition of collaboration with agencies to support shared safety objectives. Within the City of Toronto, we have worked extensively over the years with public health, fire, police, and paramedic services, to name a few. Our longest-standing collaborative program is the Prevent Alcohol and Risk-Related Trauma in Youth, or PARTY program, and we've been proudly delivering this injury prevention program to Toronto high school students since 1986. Our work is driven by statistics, and with the prevalence of violent traumatic injuries, we strive to effect change within this cohort. We have developed a new hospital-based violence intervention program, or HVIP, to promote positive alternatives to violence in order to reduce retaliation, criminal involvement, and re-injury among youth injured by violence. Our program is called BRAVE, which stands for Breaking the Cycle of Violence with Empathy. Imagine what a program like BRAVE might have done for the two young gentlemen Dr. Nathans referred to a moment ago. We've done extensive research on successful program models from our counterparts in the United States, and we've learned about the tremendous resources developed right here within the City of Toronto. To this end, we're thankful to City staff Tamasha Grant and Omar Siblis for their time and support in helping to connect us to programs like Focus, the Youth Development Unit, and other city and community resources. HVIPs were established first in the 1990s and have proven effective in reducing violent injury reoccurrence, as well as saving the shared costs associated with the care of these patients in and out of the hospital. A unique feature of these programs is the public health lens through which they operate. Like other public health issues, violent injury has identifiable factors that put people at risk or offer protection. These are called the social determinants of health. The hallmark feature of BRAVE, like other HVIPs, is the culturally competent case manager that is able to reach the patient in a critical time, which is referred to as the teachable moment. It's in this moment that a patient can reflect on the factors that led to their health crisis. It's also in this moment that an alternative pathway can be offered that includes connection to community services and support to address the underlying conditions that perpetuate violence. The goal of BRAVE is to build a bridge for our patients through a culturally competent case manager, from our hospital bed to Focus, the Youth Development Unit, and other community resources, so that together we can enable the possibility of hope for a healthy future.
Thank you, Brandy. Councillor Thompson and members of the committee, our hope is to operationalize BRAVE as soon as possible. We're now working on reducing the rate of injuries due to violence by partnering with the city through the well-established focus situation tables and connections to the larger network of community agencies. However, there is one critical element of the program that's missing: an embedded case manager as part of our team to reach our trauma patients during their teachable moment while hospitalized. To this end, we are looking to partner with the city to allocate funding to support an on-site case manager at Sunnybrook to link our patients with focus as soon as possible. With that specific ask, I want to thank you for the opportunity to present today, and we'd be happy to answer any questions. Thank you again.
Thank you very much, Dr. Nathan. And just taking it to visiting members of the committee as well first. So, Councillor Fletcher, please.
Thank you very much, and thanks for being here. It's really an important issue. Have you had a chance to work with the Medical Officer of Health around the model and the implementation plan?
No, we have not worked with Medical Office of Health.
Our Medical Officer of Health?
No, we have not. We have not had
Not
that
yet.
opportunity.
Not yet. Okay, thank you.
Is that it, Councillor? Okay, great. It was hard to hear you here. I'm not sure if the volume needs to be.
I know, it's so hard to hear me.
No, I think it's just the volume. I think it was not so much you. I think it was just the volume.
Would you like me to repeat that question?
Please.
Thank you. Yes, I just asked the good folks here if they've had a chance to work with Dr. Davila.
Yes.
Who's the Medical Officer of Health, because this is very much a harm reduction approach, and there is so much ability at TPH to help shape something like this. So that was my question, and they said they hadn't yet had a chance to work with
Okay. Thank you, Councillor. All right, Councillor Cressy.
Thank you, and thank you for being here and the work you do. I just want to understand the BRAVE program a little bit more, if that's all right. So did you say the BRAVE program is currently in operation, or you're in the process of setting it up? I just want to understand it.
It's not operational as of yet.
Okay. And then the operational, when it is set up, the operational focus of the BRAVE program, is this day-to-day client manager supports on site, facilitating connections to whether, as you spoke about it, the focus program, community crisis response and programs, other community agencies? Is that the on-site people who are connected and can make those connections for the individual to others to hop?
So, I mean, we've actually explored focus. We've had discussions with focus. What we're looking for is someone who can actually work within the walls of Sunnybrook, who we identify the patients for. We receive these patients on a daily basis, who would actually create that link to focus. So we have social workers. They're probably not the right people to do this. We're looking for the right case managers who will be able to link our patients to the focus tables.
Okay, so somebody to explore the potential of a city staff member who is engaged in this work, knows the agencies, knows the programs, on site at all times to be able to make those connections.
Correct.
Okay. No, I understand. Thank you very much, and thank you for the work.
Thank you very much, Councillor Cressy, Councillor Grimes, and then Councillor Carroll.
Thank you, Mr. Chairman. You said you did some research. Some other U.S. cities are doing this already. Is that what I heard?
Yeah, probably the model program is in San Francisco. It's called Wraparound. It's probably the longest standing program. It's now in Detroit. It's in Chicago. It's in L.A. and a number of other cities have been doing this. There's actually a national, in the U.S., a national network of hospital-based violence intervention programs, probably about 30 programs, because of the challenges they've had with firearm injuries.
Sorry, Doctor, it's called Wraparound in all those cities.
No, it's called Wraparound in San Francisco. Wraparound was the initial program, and it's since has disseminated to many other cities.
And is there a report on how long they've been going on for these programs, and is there any analysis, stats on the progress? Or?
Yeah, do you want to speak to the
Yes.
success rates?
Yeah, there is quite a bit of research that's looked at the programs that started in the 1990s and have looked at those programs over time. They've looked at them from different perspectives, whether it's economics and cost savings that might be experienced both in the system as well as in the hospital itself. They've looked at the experience of the individual patients in terms of some qualitative research and interviewing, understanding the programs that people have been able to connect to and the way that they've been able to change their life trajectory and move away from violence. And then there's other forms of program evaluation ongoing, looking at the effectiveness of these programs in various different ways. There isn't an enormous amount of research. These, 30 programs in the United States is not an enormous number, but there is an effort to understand better how to create the change with these patients through programs like this.
And they're seeing some success in these programs?
Absolutely, yes.
What we do know is that they're cost effective, so the investment in the program typically leads to a reduction in healthcare utilization, less recidivism. We know that people who've been exposed to the program are less likely to carry guns after hospital discharge, or they don't go back to their old environments and the risk factors that typically have led to them taking a particular path.
Great, thanks. Those are my questions, Mr. Chairman. Thank you.
Councillor Carroll?
Yeah, I'm trying to understand this. I think you hear us all glad that you're doing this. The city's, in fact, moving to a public health approach to the parts that are directly within our purview, and we're waiting for a report back on that. Help me understand, because you have a social work-based intervention program there, but what you're asking for is that it needs to be a person from one of our programs come right in and be situated in there. What is it they will do that a social worker that we would come and cross-train and then leave couldn't do?
So, I mean, the expertise of the individual is probably less important than their ability to link the hospital with the community-based organizations and actually navigate for that patient probably for as long as a year after hospital discharge to ensure that the right trajectory is taken and to link them up with the right people. Our social workers within the hospital tend to focus on what the immediate needs are for those patients while in hospital, and after discharge, there's no further communication. It ends at the time of hospital discharge. So we're looking for an individual who can create that link with focus and with community agencies over a period of time subsequent to hospital discharge.
So you can't, so you want to have a health-based system, but you can't make a case to the health system that they should be allowed to fund a year of follow-up?
At this point in time, there are insufficient funds from the health side of things to be able to do this. We are approaching the City of Toronto because of the challenges that we all face together in managing firearms, and this is seen as a prevention issue rather than a health issue. Unfortunately, I believe those are actually related, but this is one of those things that tends to fall between the cracks.
So you would and you have funding issues on your own side. So you would understand if we had to look into this more on our side. We're in insufficient funds because we're still waiting for $25 million that the federal government made a wonderful announcement about, but it hasn't delivered yet for our own prevention programs in this realm. So if we were to look into it, that would at least be progress towards some sort of collaboration today.
Absolutely.
Okay, thank you.
I may add as well, I think it's important to consider the collaborative approach, and what we recognize is that the competence that we're looking for exists already in the system within community agencies, and so looking at models where we can leverage relationships between community agencies and the hospital to provide that competence in the teachable moment is of critical importance.
Absolutely, thank you.
Okay, thank you very much, Councillor Carroll. And just for me, if I could, to you both, and thank you, obviously, for being here. So there's some, what I think, jurisdictional issues, and so the province actually regulates hospitals, right? And so just in terms of our engagement and our involvement, clearly we want to be involved providing solutions. Have you approached anyone at the province at this point about the program itself?
No, we have not yet. This would typically come through a hospital funding model.
Right.
There's a number of asks coming through the healthcare system for funding. You've read about hallway medicine, all those other asks. So again, the challenge with this, it tends to fall between healthcare and public health and prevention. So
right. Okay.
Hence our appearance here.
Okay, fair enough. And then you're asking for essentially a case manager, a person who would be responsible for this. So I'm just thinking that, is one sufficient? Would you not simply think that perhaps at least two persons would be at least to start the program if one person was sick for a period of time, for example, we would then negate the efforts, right? Because you wouldn't have someone who would be able to offer the services that you're looking to offer through this program.
Yes, I mean, we wanted to start off with a request that appeared to be reasonable. I will also point out that, you know, we have close relationships with St. Mike's and Sick Kids.
Yes.
We all work together collaboratively.
Okay.
And if we found a way to do this, I would say we do this in collaboration, so we have the city well covered.
Okay,
And that
that's
would
fair.
probably require more than a single case manager.
Okay.
And some flexibility across the centers.
Okay, fair enough. I'm just putting together a motion which really will involve our medical officer of health and the whole city teams, and just do it broadly enough so that our social development and finance group can actually reach out to the different partners that could help us. So I don't want to make it too sort of narrow, leaving it broadly enough. So that would be my intent for today in terms of moving forward, just so that you are aware.
Understood.
Okay, thank you. Any further questions? Okay, all right, so thank you very much. Speakers? Visiting members, seeing none. Councillor Cressy.
Well, thank you. First of all, thank you for being here and for the work that you do at Sunnybrook and the development of the BRAVE program here, modeled on what we've seen in other jurisdictions. And thank you to Deputy Mayor and Chair Thompson for bringing this forward. I think when we talk about breaking the cycle of violence, as you've spoken very effectively here too, for those at risk, how do we turn a negative incident into a turning point? And that is, at the City of Toronto, from an overarching perspective, our Toronto Youth Equity Strategy, that's what it's modeled from, is how do you, for people who are at risk of violence and falling into the cycle of violence, how do you create an intervention point so that a negative incident that happens once doesn't beget a second one? To your example of the youth who was grazed by a bullet, and then the next time you saw him, it was a spinal injury. And so I think from the interconnection between the hospital setting and our broader work, that is a point. That is an opportunity for an intervention point. It's not radically dissimilar from our pre-charge diversion program, which in the justice system is an opportunity for an intervention point for youth who have committed who have been charged for a first time with a non-serious offense. Rather than that become the first charge and the next one's a serious one, the pre-charge diversion program in coordination with Toronto Police Services and the justice system allows you to enter down a different pathway. And so this is a similar one as I see it. In this case, it is at the intake point of the hospital. How does that become an intervention point? And how do we allow that intervention point through other programs at the city and the province, and perhaps with social workers in the hospital, to start to look at some of those root causes of violence that led to that in the first place? Dealing with past trauma, the socioeconomic status, maybe you need access to mental health supports, all of those factors. So the model that we've seen elsewhere, that Sunnybrook, you've kindly come forward to say, we can do this better here, especially what you're seeing, I think is an excellent model. I think on a go-forward basis, and I look forward to seeing the motion from Deputy Mayor Thompson, is from a coordination point of view, how do we implement this and how do we effectively fund it? How do we look at this, yes, from a Sunnybrook lens, but from a system-wide lens? Sunnybrook is dealing with this, so is St. Joe's, right? And so how do we start to develop that model elsewhere? And how do we coordinate this between resources that the city's implementing, support from the province as it relates to violence prevention? But the bottom line is, so I look forward to that amendment, the bottom line is you got to turn a negative incident into an intervention point and a turning point. And we know that if we use the hospital center only to respond to trauma, but not to prevent further trauma, we're missing a prevention moment. And so I want to thank you for bringing this forward, and thank you, Deputy Mayor Thompson, for making sure this was first on the agenda.
Thank you very much. Thank you. Further speakers? Okay. Let me just speak for a minute. I have a motion that, maybe just ask the clerk to put that on the screen, please. So the motion really is directing us to investigate and to review the program, and to, of course, bring in the relationship with the additional partners who we need to have in this relationship, in my view, the province and the feds, and to work with the Tory Trauma Program. I want to thank and then bring back a report by November to help us to be able to move forward in terms of direction to look at how we can put this process in place, and I think it's extremely important. I want to thank Dr. Nathans and Ms. Tannenbaum for being here. When you contacted me, it seemed like an eternity ago. We spent quite some time. We thrashed through it. I asked my staff member, Keisha Francis, to work with you, and we've been working together to this day that you're here. I did spend some time to take a look at the wraparound program information that's available online. It talks a little bit about how the program works in terms of reducing injury and criminal recidivism. And the point that I got from it was that those vulnerable citizens at that point where they're injured for whatever reasons, and they're in your institutions or in medical institutions, they are not feeling that bravado that tends to create a problem on the street. They are at a moment where they are at, to a large extent, your mercy, because they need your help. They need attention. And they lessen that tension with respect to the attitude. And so the point you're making is that there is an on-ramp opportunity to engage them, to see how you can help them in an environment that they then believe and understand that they're safe in. And the best way to help anyone is in an environment where they feel safe. You can't help them when they're on the street and they feel that bravado and they don't want to talk to you and they can do all the things that they feel they can do, being heroic in their own personal selfish sense. And so this is a great opportunity. There's mentoring, there are all those things that you need, and we talked about what was needed, the caseworkers. So we're spending a lot of money on, when we go to policing, we've got announcement 2 weeks ago, $54 million, X number of dollars, $4.5 million for overtime, and so on and so forth. I think what we need to look at is a piece of these resources being allocated for just this program, because this is the reality in terms of how this can work. We can't prevent certain things. We realize that certain things will happen. But what do we do when we have those things? I've looked at what they've done in Chicago. We've looked at what they've done in Milwaukee, Baltimore. It's interesting, and we're looking at studying what they've done in Oakland. Oakland, California has reduced their gun violence rate by over 50%. And it's all intervention with a lot of folks coming together, including the police, community at large, everyone. So they take the position everyone is of value. Everyone should be cared for. No matter what your circumstances were, high, low, or whatever, it is an opportunity for us to be engaged. I think that having been dealing with this thing of violence in the city for a long time, all of us care, and we want to look at opportunities. So I want to thank you both for thinking outside the box, because you could just simply approach it, well, it's another one coming in, let's see what we can do to patch them up, we move on, and you go home at the end of the day. But that's not what's going on. You're saying, hey, what else can we do? How can we help these young people? I have met many of my colleagues here. We've met with a lot of these young people, some of them in wheelchairs, some of them are gone, unfortunately. But as a society, I think that we have more that we can do, and this is a demonstration of that fact, that here are some opportunities. So I don't know all the jurisdictional issues that we've got to go through, but our professional staff members are going to start that process with a medical officer of health, conversation with you, and continue conversation. All the members of this committee are going to make sure, and members of council are going to make sure we shepherd this through so we can get this system to help. Because as you pointed out, other areas are doing it. They're seeing some success. And I don't know what the degree of success will be, but the fact of the matter is it's something that we get on the table and we need to move on. So I'm looking for the report to come back as quickly as possible. We need November the 6th is when it's going to come back to this committee. If it gets done earlier for whatever reason, we will bring it on as a new business item if we can to advance it. But I know the staff will require the time. Chris, I'm just giving you some energy there. So thank you very much for your presentation here today. Thank you very much for caring. Thank you very much for your focus and looking at your city. Thank you.
Thanks so much.
Okay. All right, members, we have a motion. All those in favor? Opposed? That's carried. Thank you. Okay.
Chairman, I'm happy to move,
Vice Chair
I
Grimes.
haven't got the number for Deputy Mayor Holliday's recommendation, but I'm happy to move them on his behalf.
Okay. So Deputy Mayor is moving the item for Councillor Holliday. All those in favor? Opposed? That's carried. And Councillor Fletcher, your item was still being held. Is that? Yeah, it's. Sorry. Yeah. Councillor Cressy? Was the Deputy Mayor. He left. He's gone.
I was away for a couple of weeks, but I thought, what's going on?
So was I, apparently. So we're also, on the item for Deputy Mayor Holliday, all in favor, opposed, that's carried. And on the item for Councillor Fletcher, all those in favor, opposed, that's carried. Thank you very much. So all three new business item has been dealt with. We are now going to move to the next timed item, which is EC 7.10. And the implementation of the coroner's recommendation from the Faulkner and Chapman's inquest. The first speaker I have is Mr. David Tyndall. Mr. Tyndall, how are you, sir? Come on up. Very well. Good morning. Come on up. You may not have been here before, and this is your first time, so welcome. Thank you. And to your left, sir, on the side, there would be a clock. We'll shoot 5 minutes. Interesting enough, although I explained it earlier, so many people don't pay attention. It's an unfortunate situation. So you have 5 minutes, sir, to speak, and members may ask you questions, so I welcome you, and do take your time, okay? Thank you very much. You may start.
So first of all, while I understand as a resident, I can speak.
Yes.
I want to thank you for listening, because that's not always implied. So thank you. So I'm a homeowner in Anna Bailau's ward. I work in Councillor Thompson's ward.
Okay.
A husband, father, and then last November I became a juror at an inquest. So I was a juror at the Chapman inquest. You know, one of those moments that changes your life? That was one of those moments that changed my life. I went through, it was a month. I went through that month and learned a lot. You know, prior to that, I'd like to think we're loving, caring people, and I'd like to think that we look out for our neighbors, and I like to think that that I'm a good guy, and that I care about other people, and I still do. But now I know that you can say those things, but if you don't actually do anything about it, it doesn't really mean anything, and people die. And so you're in a very unique position that you have that ability to actually make that change. I'm in a position where I can come here and ask you to make those changes. You know, I can't help but think, and I sat there during that month and thought, I'm going to stop for a quick second and say that I couldn't say it at the inquest because I was in this row of jury members, but I know Brad's mom's here, and I'm sorry on behalf of society as a whole that we let people die. So I'm sorry. So sitting there for a month and going through all of the emotions, and as you can tell, the emotions are still strong, and realizing there's more that we can do. You know, at the end of the inquest, obviously, as a jury, we put forth recommendations. We look forward to you implementing those recommendations as written, not inferring too much into them other than they are what they are. They are recommendations, and recommendations that will prevent future deaths. I also went back and read the recommendations in the Faulkner inquest, and some strong recommendations there as well too that again will help save lives. Councillor Thompson was just talking about how he's looked to Milwaukee and to Baltimore for help with violence. I would love to hear that people are looking to Toronto for the solution, and for how to manage homelessness and how to manage people who use drugs and how to manage the opioid crisis, overdose crisis that we're dealing with today. I would love if that was the case, because I believe that we as a city are unique in the fact that we're that good. We are, you know, it's not just the motto, but we are. We still do stop and help people on the street when they need help. We still do, you know, give directions. I don't worry about my kids walking down the street in downtown Toronto coming home from a friend's house at 9 o'clock at night. If it was ever going to happen in any city anywhere in the world, I think it's this city. And I heard from expert witnesses during the inquest, and before the inquest, I probably would have said, you know, it's awful that folks are experiencing homelessness. It's awful that people are using drugs. It's awful that people are dying, but I don't know if anything can be done about it. And in 1 month, I quickly learned that you can save those lives, and you can make lives better for all of those marginalized people and all of those people that need it. And it was an emotional time, but it started something. It started a conversation with me and my family. It started a conversation with me and my neighbors. Last month, I had the opportunity to hold the Federal Minister of Health to task on it as well, too, as she came to my riding, and I thank my local MP for inviting me to, I won't say yell at her, but, you know, express my feelings to her. And I thank her for listening. But again, I can't help believe that anyone that becomes informed on an issue, and an issue of life and death, that then doesn't do anything about it, is complicit in accepting those deaths. And I'm not willing to say that there's an acceptable number of deaths that are unaffordable to prevent. And I would hope that none of you do as well, too. You know, there's been deaths in every single ward in Toronto from overdose. No doubt there's been deaths in some of your families or friend circles as well, too. And so I look forward to seeing all of the recommendations directed to the City of Toronto, and I know Toronto Police Service isn't necessarily at this meeting, but there as well, too, because, again, it's something that I know will be able to save lives. So thank you for listening, and there we are.
Thank you very much. Are there any questions? Okay, seeing none, and thank you for your service on your coroner's jury duty, sir, and your point and your comments have been well taken by this committee. Thank you very much for your time.
Thank
you. Okay, the next speaker I have is Arif Aaron, the Interfaith Coalition to Fight Homelessness. He's not here? Okay, Councillor, you know him, right? So, okay, fair enough. So apparently he's not here. Thank you. I have the next speaker is Amber Kellen from the John Howard Society of Toronto. Ms. Kellen? Thank you. Good morning and welcome. You have 5 minutes to speak.
Thank you very much. So just good morning, and I want to thank you for the opportunity to speak to you today, but I also want to once again acknowledge Brad's mom and send my condolences once again to the family. My name is Amber Kellen. I'm one of the directors at the John Howard Society of Toronto, and I've been there for over 22 years. I've held both frontline and management positions, and today I'm speaking to you as the Director of Community Initiatives, Policy and Research. For those that are not familiar with John Howard, we're a nonprofit United Way anchor organization. We have over 100 staff working daily to fulfill our mission to help make communities safer by delivering individualized and integrated support, empowering those in conflict with the law to achieve positive change. I want to thank the City of Toronto for this report to action and to point out that last winter our agency had full standing in the inquest into the death of Bradley Chapman. I was very pleased to see one of the jurors here who I recognized right away, so thank you. In the interest of time, I'll only be speaking to 4 recommendations, 3 from the Chapman inquest and 1 from the Faulkner inquest, respectively. In order to contextualize my remarks, I want to share some important information with you. Studies show that those who are released from custody have higher rates of mortality, more chronic health, mental health, and substance use issues than the general population. Former prisoners are also more likely to suffer from brain injuries, cognitive impairments, trauma, social isolation, and poverty. They're disproportionately represented throughout the homeless population and face high risks of accidental death caused by drug overdose. In fact, 1 in 10 opioid overdoses occurred in former prisoners within 1 year of their release from jail. For over a decade, our agency has spent time, energy, and resources exploring and verifying the nexus between homelessness, substance use, and incarceration, as have many medical professionals and academics alike. Between 2009 and 2010, as part of a research study that we did, we discovered that more than a third, or 33% of respondents of the 363 inmates surveyed, expected to be homeless upon release. That is, living on the streets, sleeping in a shelter, or couch surfing. An additional 12% had no idea where they would live once discharged. We hope to replicate this study in order to grasp the current magnitude of the problem today. Further, Toronto, and specifically South Etobicoke, is home to Canada's largest jail, the South Detention Centre, which at capacity houses 1,630 men. Over 95% of the people at that jail and over 65% of all inmates across the province are on remand. This means that they've been charged but not convicted of any crime and are awaiting trial. With no definitive release date, discharge planning is almost always impossible. Many people are released from custody while attending court without the bare essentials, including medications. Even those who are sentenced are in custody for relatively short periods of time. In fact, the average sentence in Ontario is 32 days, and this is often just enough time to lose custody of a child, be terminated from a job, and lose one's housing. Since 2006, the John Howard Society of Toronto has advocated for the city to seek options that will assist our clients in maintaining their housing. Therefore, we support actions related to Recommendation 21 from the Chapman Inquest and any and all efforts that SSHA will be making on their submission, specifically in the 2020 budget process to enhance funding for the eviction prevention in the community program and to explore how it can increase support for those at risk of losing their housing while incarcerated. In order to respond to the needs of the people that are homeless and who have been in conflict with the law, we have to understand their housing and support needs to develop and implement programs. Therefore, we're also in support of the city's initiative to better utilize the tools that they have to collect data, increasing the effectiveness of its street needs assessment. We support the action that responds to Recommendation 22, that the SSHA will work with health and correctional sector partners to explore further how specific methods and questions can help better understand the housing needs of people in correctional facilities and hostels. Currently, there is no men's shelter anywhere in South Etobicoke and only one out of the COLD program that has a capacity for 25 people when it's open. Each month, our reintegration services trailer, our staff and peer support workers see approximately 100 people. Most of them are desperately seeking a safe place to stay upon release and have had little choice, we've had little choice but to refer them to shelters or respite centers located primarily in the downtown core or to the city's Streets to Homes Assessment Referral Center. This is about 90 minutes on public transit from the jail. Therefore, the John Howard Society fully supports the proposed action related to recommendation number 3 of the inquest, which states that as part of the city's shelter expansion initiative that they are actively looking for potential shelter sites in South Etobicoke where the detention center is located. Finally, transitional housing that includes case management has been proven to provide stability and connect people. Since 1995, when the provincial halfway house system was abolished, we have had no specific transitional or supportive or permanent housing for people who are leaving custody. We have long advocated for the opportunity to manage and open and develop specialized housing. And
I'll give you 30 seconds to wrap up, ma'am.
thank you. One of the reasons we've been unable to do this is because of the exclusionary zoning, and therefore we support the recommendation stemming from number 35 of the Faulkner inquest to revisit those bylaws in order to improve multi-tenant house licensing. In closing, I just want to say I understand that the City of Toronto is not responsible for Ontario's correctional facilities, but the fact remains that both before and after going to jail, many, many people that are homeless rely heavily on not only emergency services, but also the city's programs. We hope to see these actions go forward and are very happy to help to assist, to provide any information to ease the process required for implementing the actions in the report.
Okay.
Thank you for your time.
Thank you very much, ma'am. And if you would, if you could, your notes, if you'd like to submit that to the clerk.
Yes, they have been.
They have, okay, fantastic. Thank you very much. Okay, so let me just see if there's any questions of you. Visiting members, seeing none. Councillor Carroll, question.
Thanks. One of your last points, the recommendations about multi-tenant housing licensing, we are actually very soon going to be looking at that at City Hall. And I expect it's a two-step approach that we'll first see some improvements on the rules of where we do license multi-tenant housing or rooming houses, if you will, and then a zoning approach. But there's also a hallway chatter that, no, let's just ban them all. If we ban them all and we didn't have those housing opportunities, the problem that the inquests speak to just gets 10 times worse or 100 times worse, does it not?
Absolutely. More people will die.
So we need to license, regulate, and monitor.
Absolutely.
Okay, thank you.
Thank you very much, Councillor Carroll. Any further questions? Okay, seeing none. Thank you very much for your presentation, ma'am.
Thank you.
Our next speaker is Lynn Ann Mulrooney of Registered Nurses Association of Ontario. Ms. Mulrooney, how are you? Good morning and welcome. You'll have 5 minutes, ma'am. Thank you.
Thank you. So good morning. I am a registered nurse and a senior policy analyst at the Registered Nurses Association of Ontario. Thank you very much for the opportunity to share RNAO's perspective on the City of Toronto's implementation of the recommendations for both of these inquests. RNAO was granted the privilege of being designated by the coroner as a person permitted to make submissions at both inquests. RNAO was present each day to hear the compelling evidence. These were the first inquests into the deaths of people who are homeless in more than a decade. And so there is an additional responsibility that the jury's recommendations be carefully considered and implemented. I see Mrs. Chapman, the person I always knew as juror number 4, David. Other people who were parties to the inquest, and the city staff that I know worked, like Mr. Tanner, that were there all the time. And so in addition to the kind of cut and dried recommendations, there's an enormous amount of pain that went into going through this process and trying to unravel what it is that went wrong, as well as resources of time and lawyers and so on. So I think it's such an opportunity to learn from the lessons of these deaths and try and help prevent it from happening again. So we really respect that the City of Toronto is a leader in demonstrating the effectiveness of harm reduction as a means to reduce deaths from the toxic drug supply. At Mr. Chapman's inquest and in the media, Dr. Davila has described the overdose crisis as the defining health crisis of our time. While fully appreciating the work that the city has already done to advance some of the recommendations from both the inquests, much more and quicker action needs to be undertaken. RNAO shares with you the common objective of a city and province where all people can live in health and dignity. In order to make that possible, we urge a greater sense of urgency from the city in addressing homelessness, lack of affordable and supportive housing, and a public health approach to drug policy. RNAO has also has a written submission that contains more detailed rationale as well as references for your consideration. Specific measures that we urge the city to undertake include fact-checking to ensure that reports of the city's actions are congruent with the evidence. As an example, one of the attachments states that the number of individuals who died while being homeless be posted online quarterly. In fact, when you go and look at the website for the City of Toronto, the most current snapshot we have of the number of deaths of people who are homeless is from December 2018, which is 9 months ago. So it's critical that the city improve rather than backtrack on accurate data collection and reporting in order to prevent deaths of other people who are homeless. A second example from Mr. Faulkner's inquest in attachment 1 claims that residents are able to access cool spaces through the heat relief network. Information on a website is not the same as actually having access to a cool space now that the city's cooling centers have been closed. Directing people who are homeless to respite centers and drop-in centers that are full or over capacity is cruel, and suggesting splash pads and shopping malls as an alternative has resulted in some very traumatizing experiences for people who are being told to move along. So RNAO urges the city to abide by the spirit and the intention of the jury's recommendations at the Chapman inquest. The last recommendation asked that recipients of the recommendations report back to the Office of the Chief Coroner and parties to the inquest in 6 months, and then annually for 5 years in an open letter regarding the progress made with respect to these recommendations. In order to ensure action, accountability, and transparency, this recommendation should be applied to both inquests and the city's actions should be
Give you
reviewed.
30 seconds to wrap up, please, ma'am. It's
Sure,
you're at
thank
5
you.
minutes.
So this recommendation that the city report back annually for both inquests, we really hope will continue for the next 4 years and not just stop today. So thank you very much for your attention, and I'm happy to respond to any questions.
Okay, thank you very much for your presentation, Ms. Mulroney. Are there any questions for Ms. Mulroney? Okay, seeing none. Thank you, ma'am. Members wishing to speak? Is there a question to staff, or is there anything else further? Okay. Councillor Cressy.
Well, thank you, Mr. Chair. And I have an amendment first, if it can be put on the screen. I guess I'll begin my remarks, and I'll speak to the amendment shortly, is I never knew Grant Faulkner or Brad Chapman, though I've had the great privilege of getting to know Brad's mother and sister and over the last couple of years, and have been frankly inspired not only by their courage to continue to use the untimely passing of a loved one as a moment to create further change. And I don't know how a mother or a sibling is able to do that, but I'm inspired by it. And when I look, and as somebody who followed the inquest recommendations very closely, in my capacity as chair of the Board of Health and as a member of this committee, I look at the objective of the inquest is to prevent another Grant or Brad from dying from a preventable death. That's why this inquest happened. Its purpose was to prevent a reoccurrence. And when I, having read through the inquest and looked at the recommendations where we are now, I'm reminded of the two cities that exist that we have. And on the one hand, we have, I moved it at the beginning. At the beginning, sorry about that. On the one hand, there is what I would call tech, towers, and TIF. Today we open TIF and towers are booming and the tech industry is flying. All are great things for our city and things that in our economic development lens, this committee and our chair has championed to great effect. And then on the other housing side of the equation in our city, we have housing, homelessness, and opioids. And these are two very different cities. And this is what the inquest is about, is to look at how do we create a city whereby we do not have preventable deaths. We are the most unaffordable city in the country to live on housing. We have a homeless population that has doubled in 4 years. And we have opioids, which have become, according to our medical officer of health, have precipitated the most deadly public health emergency of our generation. The previous item we dealt with talked about gun violence. Numbers came out just last week that in Ontario last year, 1,400 people died from opioid-related overdoses. 650 people died last year from motor vehicle collisions, and 200 people died from homicides. And on those numbers, the number that is continuing to skyrocket is opioids. All three are tragedies. All three require the same level of urgent response. And so the solutions, as this inquest have talked about, are not easy. And they require all levels of government, and they require big change around strengthening our safety net, providing opportunity in housing, changes to zoning, you name it. But in the immediate, whether it's shelter or harm reduction or outreach workers, we know more needs to be done. And we know in the recommendations in front of us that our staff have diligently gone through to articulate what the action has been taken in some areas, in particular around eviction prevention and around our outreach workers, both need to be considered as part of the base budget submission going forward. Otherwise, we risk not only failing to meet the inquest recommendations, but failing to live up to the objective of this, which is to prevent another Grant or Brad from passing away far too early. Thank you very much, Mr. Chair.
Thank you very much, Councillor Cressy. Any further speakers? Okay, seeing none. I would just like to, because I understand Mrs. Chapman, you're here. I just wanted to, on behalf of this committee, just to extend certainly my condolences. And I realize some time have passed, but unfortunately, what occurred with respect to your son hopefully, and as the jury number 4 has pointed out, Mr. Tyndall, that we can do better. And it's very unfortunate for your loss, and we greatly regret that, of anybody dying in our streets for whatever reasons. Save and except, of course, if it's by the ultimate, by being sick or for some other purposes, God taking us to heaven and wherever one wants to go at that particular point in time in terms of your religious beliefs and so on. It is not lost on us that you've lost a child. And as a mother, and all of us here are parents, we have family members and so on. We don't know whether or not it could be one of us as a member of council who are in need of this service. So none of us is immune to this. So we should all look at it from a lens that gives us a perspective that this could be one of us or a member of our family as well. And so I just simply wanted to convey to you that it's not far from our thoughts, and as part of our process and challenges as we face them in terms of resources and what have you, it is that human resources and human needs come first, which is part of our thinking as members of this committee. And I know members of council and the mayors also feels the same way. And so I just simply wanted from us to you, and certainly to the Faulkner family as well, but I know you're here, we just wanted to extend to you our condolences on the loss of your son, and to certainly let you know that we are going to do our best to try to ensure that we can live up to the recommendations that have been put forward and the items that we're responsible for, and to support the request that's been made by other agencies and other organizations to do more to ensure that our citizens are not being failed by the system that is in place. Because I think, as been pointed out, we can all do better. And as Councillor Cressy's commented, I do think that the support for Councillor Cressy's motion is helpful, because we need to make sure that we can reach people in the streets who are in a variety of levels of crisis to help as much as we can. So my condolences, and thank you on behalf of this committee. Thank you. Okay, members, we have Councillor Cressy's motion. All those in favor? Opposed? That's carried. We have form. Okay, thank you. I guess we have to just wait for a minute, Councillor Grimes. Oh, Councillor Ford's back. I just have to step out of the room for a quick moment. I just have a quick meeting, and I'll be back, and Councillor Grimes will be chairing. And the next item, you got it? Okay, excellent, Councillor Grimes. Yeah. Sorry, I'll be right back. Okay, your mic's on.
Okay, we'll go to 7.1, Toronto Fire Service Transformation Plan Update. Councillor Carroll, you held the item.
Yeah, a couple of questions, and one I'm pursuing on behalf of Councillor Fletcher, but first, I have a question about, this is, and it's syntax, but we had the report before us, we're getting the update, but we did ask for a review, so that if we could make efficiencies in 2020, we would be able to do them in time for the budget process. In the body of a report, it says you're deferring that. Should that not be a recommendation? Council asked for it for the 2020 budget process. Should there not be, rather than a report with a motion to receive, should we not be getting a report with a recommendation that we defer the efficiency study so that council can decide whether to defer something?
To the chief.
Yeah, through Mr. Chair, I would defer to clerks on the process for that. My understanding, in the conversations we had in the review, we were of the understanding, and I'm of the understanding, that this is an appropriate means.
Yeah, I read the rationale, and I'm okay with that, but I don't want to set a precedent where council moves a motion, sets a date, and just in the body of the report, the date has changed.
We need the question repeated, Councillor Carroll, I'm sorry.
Well, what it is council moved a motion last year during our 2019 budget process saying that we would like a report back before the 2020 budget process so that we could look at while we've got a longer range look, of which this is an update, at fire services, that if we wanted to create some service improvements and/or efficiencies for the 2020 budget process, that we needed those recommendations before the 2020 budget process. That report is now deferred to the 2021 budget process simply by, and it's not that I'm picking on you, if it was in any other report, I would be making the same fuss. It's simply in the body of the report that the staff member is moving that report to 2021. Is that not the responsibility of council to move they made a motion, they wanted the report in 2020. Do we not need a recommendation that we can adopt that says move that review to 2021?
Yeah, we have to look into that, Councillor Carroll. We don't have, do we have the original motion before us? No? Was it a request?
Well, it's spoken to in the report.
Was it a direction or was it a request?
It was a request, a direction. I think when it's city body to city body, it's not like we made a request of an outside agency. It was a request of staff, which is tantamount to a direction.
Okay. Councillor Carroll, we haven't got the answer to that right now, but if we adopt this recommendation, it'll go to council. Maybe it gives us a couple weeks to get your answer for you.
Okay, yeah. I'd love to have a clerk's opinion, but if there's time needed, no problem. The other issue is there's a mention in here. Yes, it's on page 6 of the report. Requests for Toronto Fire Service data are now being fulfilled more quickly and with greater accuracy and consistency than in the past, which we've noted in reports. These reports and dashboards are dynamic and updated automatically and in real time. That caught my attention because we now, because the police services have the ability to do that, Councillor Ford is on the board this year, they get that monthly dashboard, and after a certain time, we even got to the point where it is now a public report. Anyone can look at it in the agenda. They found the way to scrub the data, et cetera. I'm wondering if the chief could comment on whether or not there would be value in presenting a dashboard, even if it was only quarterly, to this committee on fire service response. From time to time, there's concern from councillors about, because it affects the TCHC budget, for instance. Councillor Fletcher was saying if they've got information in real time, she's on that board, and she said, I'd like to know number of visits, number of fires, and number of false alarms, because we're paying for them. Is there any thought towards delivering a dashboard that you now have the capability for, delivering it to this committee?
Through you, Mr. Chair, thank you for the question, Councillor. A couple of things. So we have significantly enhanced both the volume and the significance of data that's presented in our annual report, here in hard copy, available online.
Yeah.
So that is a comprehensive picture. I would caution against requesting response time metrics that are as tight as quarterly, Councillor, for the sole reason that the data set becomes so small that it would be very prone to wide fluctuations. In our analytics experience, we need a year's worth of data to give you an accurate depiction. And I'll give you one quick example. We have one big storm that will move our response time numbers by multiple percent. So I would caution against anything tighter than an annual. The other comment I would make, Councillor, all of the data that you are speaking about is now uploaded transparently to the open data portal. So in addition, so all of that raw data is available publicly. So you can view it from the TFS perspective in an analyzed means, or if anyone is so inclined, they can access the raw data by the open data portal.
And if TCHC as a body, last question, yeah, sorry. And if TCHC wants their data, you're in a better capability position. Would you be able to meet TCHC's request if they want theirs pulled out?
Through the chair, absolutely we can. Our data our analysis and reporting capabilities are I will say, much better. Much better than they've ever been in the past, and are actually leading edge in terms of fire service performance across North America.
Okay, thank you.
Councillor Ford, the question?
Thank you very much, Mr. Vice Chair. Through you to staff, I've read the report and the update. I think it was very clear and laid out very well. But I do have a few questions on it. So on page 8 of the report, you narrowed it down to 6 kind of objectives you want to modernize. How did you arrive at these 6 specific topics?
Through you, Mr. Chair, Councillor, these are the six themes that were drawn from the previous council-endorsed or council-received master fire plan. So there's a couple of processes. The master fire plan draws on and builds with an eye to delivering on the city strategic plan objectives, the overarching strat objectives. That informs the master fire plan. The transformation plan really is an implementation mechanism to achieve and to drive the requirements contained within the master fire plan. So if you view the master fire plan more of a strategic planning document, and we're actually in the process of evolving that as a result of our accreditation under the Center for Fire Accreditation International. I'm not sure that we'll continue with the master fire planning concept. My sense is we'll transition to a more transparent, more easily understood strategic planning process. But in any case, whatever nomenclature you prefer, that's drawn out of the key strategic objectives that were identified in the master fire plan.
Right. And with that being said, have you looked at other, I guess, fire services around North America and how we're driving this transformation?
Through Mr. Chair, we absolutely have. And in fact, Councillor, I just referenced our international accreditation. As we reported at Council, Toronto Fire Services was recently awarded CFAI accreditation by the Centre for Public Safety Excellence. That is an international accreditation whereby every aspect of our operation has been independently evaluated against a plethora of key performance indicators and measurements, culminating in the unanimous recommendation by the Commission to accredit us. So that is literally the process by which we are being evaluated against literally the best of the best.
And I think I read in the report that we are the only fire service in North America and the largest fire service?
Yes, through you, Mr. Chair. When on the day we became accredited, the City of Toronto became the largest fire service in North America to have an accredited fire service.
And then I remember, Chief, I think it was 3-4 years ago when I actually first came on the council, we were talking, one of the challenges you put forth as we were chatting and kind of giving me a briefing on the fire service is as Toronto grows and becomes a much more vertical city, that is challenging for the fire service. How does that kind of work into this transformation and adapting to that emerging and current way of life and continuing to go in that direction?
Through you, Mr. Chair, you're absolutely right, Councillor. And this, the transformation plan, it is one of the key objectives, and one of our key priorities is to fully understand and not only catch up with, but get ahead of and certainly endeavor to stay in line with the vertical growth and densification. So, Councillor Carroll, as she raised, this report does make the recommendation. It is my request and recommendation that we defer the efficiency report for a year. The reason for that is twofold. Number one, the CFAI recommendations came to us midstream. So while we were in that process, CFAI happened, that produced some very valuable recommendations that, candidly, I would be remiss if I didn't evaluate and embed into the recommendations going forward. So that work is ongoing. Secondly, we are undertaking, right now, as we speak, we are in the midst of what I refer to as an operational deployment review. We are literally looking at every aspect of the way that we respond to emergencies. That includes looking at optimizing our staffing levels on the trucks, confirming that our deployment matches current risk. We're looking at apparatus and truck design. And, one quick example of, two quick examples of truck design is, there's been a lot of attention in the media recently about services that are working to make their fire trucks smaller. We're actually leading the way. So the design spec for Toronto pumpers is smaller than some of the other cities are what they are touting or they're reporting as being the reduced size truck. Our pumper spec is already smaller. We're also looking at extended reach, high density urban aerials. So looking at specific specialized equipment to help us continue to deal with tall buildings.
Excellent.
Seeing no further questions. Speakers. Councillor Carroll.
Yeah, I just wanted to make sure that people understand that my intention in asking the procedural question is we had a look coming in the door from summer vacation of the number of reports requested just before the end of election, the number of things we asked, could we please get this halfway through 2019 or before budget process? The number of things we moved coming in the door is pretty voluminous. And I think we easily start to lose track of what we directed and when we're going to get it, unless we make it a recommendation. We need to be reminded in the report with a real recommendation. You asked for this. Are you okay not getting it until a year later? Because if we don't, we're really going to run afoul of our own financial goals. Because that motion was set as a financial goal. We want to know what we're doing with Toronto Fire Service this year. If it has to wait, I think council needs to adopt and vote on that. That's why I'm asking if we can look at that in time for the council session, so that we're really clear on what we wanted to do by 2020 budget, what we wanted to do by 2021, et cetera. To have it just in the body of the report, we run the danger of only the people in this room read that whole report and see that, not all the members of Budget Committee, maybe not even the budget chief, who knows? So I'd rather it was in the form of a recommendation. So I just want to get an opinion of that back by council, because when my chief of staff showed me the number of things we asked for, I just about fell off my chair. So this would help us keep track of those things. Thanks.
Thank you. Any further speakers? Seeing none, I'll move the recommendations before us to receive. All in favor? Opposed? Carried. 7.4, engagement nonprofit organization to provide mentoring programs for children 7 to 11. Councillor Carroll, you held the item.
I did, and I had a lot of questions on it, but since then, because we were meeting on, oh, is there a problem? Are we gone to the wrong item? Oh, you had, oh, sorry. Yeah, I did move the motion. Yeah.
Sorry, Mr. Chair. I know I'm here a lot, and you probably thought I was a member of the committee. I did have some questions of staff. So I just wanted to begin by thanking you for doing this. I wanted to ask, in the report it talks about a meeting that was held on July 8th, and there's a total of 19 organizations and 7 attended. Would it be possible in the next rendition or the next part of this report we could get a list of those organizations that attend? And also if councillors in Scarborough could be invited to the meetings as well?
Through the chair, absolutely.
Okay. And in terms of mentoring 7 to 11-year-olds in this report, and you've had the meeting, I was kind of surprised by the low attendance at the meeting. Where do you see this going, the next step in this?
Well, we are, through the chair again, we are happy to meet with the groups and to help facilitate some discussion. They did indicate an interest in collaborating, so we're prepared to facilitate another meeting with the organizations. The organizations themselves have identified that they needed assistance with outreach as well, so we can do a broader outreach with the organizations.
Okay, and further in the report, there was a survey that was done, and there's 5 organizations that responded back to the survey, including Big Brothers and Big Sisters of Toronto. Their CEO deputed here before about the 40 developmental asset model. So will you be moving forward? Is Big Brothers Big Sisters moving forward as part? of the next stage, or?
Well, through the chair, that organization was invited to the meeting. They are active in Scarborough, so we'll continue to engage with them as well. There was a discussion about the 40 developmental assets, and so there was an awareness, but there were some challenges that were identified, so we'll continue that discussion.
Okay, and sorry, challenges that were identified were, can you speak to those?
Well, part of the challenges that were identified was the training of staff, the cost to train staff. Some of the organizations have informal mentoring programs, other have formal, so where it's adaptable and where it's not. So this was the information that was shared with us.
Okay, and then in the report, it also makes a reference to costing for full implementation would depend on a range of tools and products. So is that something that you're expecting that we're going to have to ask for a budget request next year?
Costanza? Yep. Respectfully through the speaker, I think that what we might want to do is look at how a pilot could be supported and if the 40 developmental assets would actually be the model to go with. I think there is need for more consultation with the agencies and organizations. Because it is 7 to 11, we would ask that Children's Services really take a look at this item and figure out how it could sort of be adopted as part of some of their ongoing work, especially with the building of the middle year strategy.
Okay, and when do you think you would be able to report back on that? Would that be next meeting or the November meeting? I'm just worried as...
If we could have a motion to work with Children's Services, SCFA and Children's Services on the build out of this next leg of potential pilot, that would be helpful for us. We have been working with Children's Services so far, and we would welcome their input and ongoing advocacy around mentorship for 7 to 11.
Okay, I just want to make sure we keep moving on this, and I know as we've already started on the city budget cycle, that if we need to have monies from the table to help, from the city to help support this, that we don't miss that opportunity.
Respectfully, through the chair, we would suggest that we talk with our colleagues over in Children's Services to see what's feasible in terms of moving this forward and potentially doing some cost out if necessary.
Okay, all right, thank you. Thank you, Mr. Chair.
Councillor Carroll, sorry, round two.
Thank you. Yeah, I've ended up having some conversations with staff, including because I was meeting on a different matter with Children's Services, because if we go down to this age, we're now talking about kids who are going through the Children's Services books, if you will, and going to ARC programs after school. So I've ended up talking to all of them. My question is, well, we're talking about the mentoring starting at an early age. If we're continuing to look at this, if we're looking at maybe piloting something, and Scarborough has agencies such that would be a good place to start, would this then be something that is also commented on in the overarching youth review that's coming back to us soon? Would it be incorporated in that, or are we starting down a separate road?
So respectfully, through the speaker, the youth service review is really about youth services starting from the age of 13 to 29.
Yeah.
So it won't come back as a potential pilot through the youth service review. What could potentially happen is that mentorship may be an outcome identified in the youth service review, but the space for mentorship programs for 7 to 11 really sits with Children's Services in the middle years, potentially in the middle year strategy, and that's what we would need some consultation on and engagement on and with our fellow colleagues in Children's Services.
And when is the youth service review scheduled for now? Do we know roughly when we expect it back?
We, respectfully through the speaker, we are supposed to come back in Q2 of 2020 with a report and looking at some optimization options from the youth service review.
Right, we've had an update on it. But at that point, we'll get the biggie.
Can I ask the GM of Children's Services to answer? Comment on this too, please.
All right. Just a comment. Hi, Councillor Carroll. Through the chair, just to provide some context. Through the Toronto Child and Family Network, Children's Services and a number of city partners are working on a middle year strategy. The partners in that network include Toronto Public Health, Toronto Public Library, Parks, Forestry and Recreation, SDFA, and Children's Services. So together, we look at a range of services across the city, not just childcare, because essentially our mandate is licensed childcare, but we look at a much broader middle year strategy. So through that table and through that group, we are looking at opportunities, and we will continue to collaborate and look for opportunities.
Okay, thank you. So we have that going on and could start out. Is it clear, though, we should sort of stick to where we want to stick to in the youth service review, but it's going to be up to this committee to really be mindful of the fact that we actually also have a strategy that starts at an earlier age that we're moving forward with, that actually leads into whatever we're doing at the youth service level starting at 13. The two have to be complementary in order to succeed.
Through the chair, yes, no question, Councillor. The two would have to be in concert and speak to each other.
Okay, so that's going to be that'll have to be the mandate of this committee to make sure that the tracks sort of complement one another. Okay, I'm gonna ask to be on the speakers list as well, Mr. Chair.
Thank you. Councillor Thompson, a question? No? No questions? Speakers? Councillor Carroll?
Okay. Yeah, I just wanted to thank the councillor for moving the motion in the first place, because certainly starting where we have some agencies and you can set up a table and begin to work with partners is important. The 40 developmental assets model that staff are working with, I had never read through. So we hear staff speak of it, and now I actually, I can grasp it myself. But I met with the various staff pieces on this, because I am concerned that we keep forgetting that we have a really major review coming back to us on where are we in youth services. It's a bit of a patchwork that comes out of all of the various times we've received funding at crisis points, and what do we build out of that? What do we seed, and how do we keep it going? So I'm happy if this work continues on in Scarborough. I'm not going to move a motion. I just hope that it's done in such a way that what we're looking at is making sure that if we start something, we're starting something that can be scaled up and move across the city. With keeping in mind that the agencies and the players may change, and that actual one-on-one mentoring is a much trickier service. So do you want to have it overseen by the large organization, or does it need to stay inside a small component? I know there's a motion coming to look at piloting. That's my main concern, is that whatever we pilot is doable if we had to scale it up. Thank you.
Councillor Thompson to speak.
Thank you very much, Mr. Chair. There's a motion that I have, and this motion, by the way, has been through staff consultation and direction, so it's not a surprise to them. Certainly want to thank Councillor Ainsley and his doggedness, wanting to make sure that we are on this and helping. I draw your attention to A of the motion, where we're looking at changing the ages from, that was in the summary report, that was, I believe, from 7 to 11, and we're going from 6 to 12 and so on. And it's important that, as Councillor Carroll pointed out, when we pilot any type of initiative or program, we have to ensure that they can be scalable so that it could benefit other areas in the city and so on, that we don't have to replicate and duplicate and so on. So it's extremely important for us to do this. I too, Councillor Carroll, have only recently became acquainted with the 40 developmental assets and so on, because it's our staff obviously are quite intimately in tune with them, and rightfully so. But for us, it's more information that's coming forward, and it's actually helpful because it does make a whole lot of sense. I do think, though, that as we've heard from the CEO of the Big Brothers and Big Sisters, and she's been here on a number of occasions speaking to us about how we can actually help and how organizations that are out there already in the community doing things, how we simply, it's about collaboration. How do we put our resources together in order to complement one another so that we can actually help the people that we actually want to help. And it goes for other initiatives that we do here at the city and so on. So this is intended on just addressing the ages, and also to be brought back as this mentoring program process comes back. We'd like to see it here at committee in November. I might add that we've had some discussions with the mayor, who obviously completely supports the need to be engaging in more program or mentoring and so on to help our young people. And so I'm very delighted that obviously he is, and as he would be naturally with these types of things, to be fully supportive of this process. And hopefully we can get this back and implement it, get the information, because the measurements we have to have as well, to understand how we can actually make this scalable in a citywide process. So that's the motion, and again, I want to thank the staff. And just let me take a moment to really say this about our staff. It's really, really important to understand what they're doing and their level of professionalism and understanding of these issues and so on. I've had a tremendous amount of interaction with the staff dealing with some of these issues. We have a person in my own office who is responsible strictly for community and social development and so on, working with the community. I have a member of the Birchmount Resident Association who are actually here with us today, who's interested in this issue. And so there's a lot of eyes looking at this particular issue, and then there's a lot of hands associated with those eyes who actually want to implement and actually do something about it, so that it doesn't simply become a conversation that we continue to have without any real impact or results. So I'm hoping that this will all come together in order to address the issues that we want to face well before we hear about any of these young people becoming any of the statistics that we see all too often in the city of Toronto. Thank you, Mr. Chair.
Thank you. Seeing no further speakers, Councillor Thompson's motion's on the screen. All in favor? Opposed? Carried. On to our last item, 7.6, formation of business improvement area in Scarborough, east of McCowan Road. Councillor Ainsley.
Thank you, Mr. Chair. I just had some questions to staff about, so I understand the process. And the reason I brought this forward is that, so in the city of Toronto, south of the 401, east of McCowan, there's no business improvement associations. I've tried to form them previously. Mr. Major, we've discussed a number of hurdles around building them or creating them in eastern Scarborough, and I was just wondering, the process that's outlined, and I've raised my concerns with you, how the business office can help me as a councillor engage the business community in that part of Scarborough.
Through the chair, usually the business community comes to us, or the local councillor will have heard from a few interested businesses in pursuing a BIA. We'd be happy to sit down with you, and in this case, probably through the councillor's office, to organize a meeting with the business community in whatever area you're interested in. We'd be happy to send out notification to the businesses and attend those meetings and inform them, more of an information session.
Okay, and is there a database? Because one of the issues that I have, there's lots of mom and pop businesses. You know, there's a lot of strip plazas. There's reference to BIA staff going out and meeting with Scarborough Business Association and the industrial area. But in southeast corner of Scarborough, except for a small pocket of industrial, it's mainly mom and pop businesses and plazas along Kingston Road, Lawrence Avenue, Markham. I have property owners that are in China, they're in Asia. I don't know how to get around that hurdle, because in the process it talks about reaching out to property owners But when I have a lot of rental businesses, once again, mom and pop, the property owners are in Asia, Europe, how do you deal with that?
So through you, Mr. Chair, we would have to put some feet on the ground and actually collect that database of tenants. We do have the list of owners, but as you said, some are may not be in Toronto. So we'd have to work with you and probably put that database together.
Okay. And then in terms of...
Just to add one thing, if we are going to send out a notice as well, we could do a drop directly to the businesses rather than mailing through the owners.
Okay. And then larger organizations like banks, I'll use First Capital, which is a large property owner in my area. So there's already a database of that, or would you just move forward? I know there's polling that has to be done.
So we have a database of owners of the property. That's not an issue. It's with the small mom and pop tenants that we currently don't have that database. We'd have to put some feet on the ground and collect that data.
Okay. All right. Okay. Thank you. Thank you, Mr. Chair.
Any further questions of staff? Seeing none, speak.
I'll just speak briefly.
Councilor.
I just want to say I'm looking forward to working with staff. I've always been happy with the economic development staff. You know, there's references in the report around the Scarborough Business Association, the work that they've done in industrial areas, large projects in my area. I talk about Centennial College that's under a huge renovation and build, University of Toronto Scarborough, the hospital networks. The reason I brought this forward, though, is if you come out to Scarborough, once you get south of the 401 east of McCowan, there's no business improvement associations. I have a scattering of community associations, but there always seems to be that disconnect around residents associations and businesses. My previous ward, for example, in Kingston Road, residents always talk about, you know, why would we go up and walk on Kingston Road? Businesses in the area will talk about other areas where they see the split in financial support around public amenities like benches, banners, planters. You know, as we're trying to improve the area, I think it's important to have business improvement areas there. City of Toronto, going back to 1970, we were the first city in, I think, worldwide that created business improvement areas. There's close to 90 of them now in the City of Toronto, none in the southeast corner of Scarborough. I think that's a missed opportunity as we're trying to improve the business community. I think it's important, just a number of items here. We had Tabia that provided feedback, business improvement areas around the homeless issues in the City of Toronto. I think it's really important that we have BIAs in that area, and I'm looking forward to working with staff. The other kind of component is, you know, business associations we don't support financially, and there's not that partnership there, so I think it's really important to have business improvement areas developed. Thank you.
Thank you, Councillor Ainsley. Seeing no further speakers, I'll move receipt of the item. All in favor? Opposed? Carried. I think that's it. This meeting started off a little slow, but it finished off strong.
Oh.
Motion adjourned by our chair, Chair Thompson. All in favor? Opposed? Carried.